welcome once again. Today we'll be covering the anatomy of the pelvis. So ideally, that's how the pelvis will look like, a hemisection of a pelvis. So on this hemisection of a pelvis, you can be able to appreciate this is a pubic symphysis. So the cartilaginous joint that is being formed by the two pubic bones when they come together. The secondary cartilaginous joint there. Then you can be able to appreciate at this point, you have the vertebral column. You can see the intervertebral disc there. These are the lumbar vertebrae, and then you have the sacrum there. And then you can be able to appreciate the canal. In this canal, in the sacral region, will be containing the cauda equina, the filum terminale, some lymphatic, some fats will be found in there. Okay, then you can see this point. This is a sacral promontory. You can see the sacral promontory there. For the other structure that you need to appreciate is that you can see here, you have the bladder. That is a bladder. Inferior to it, you can appreciate, you have the prostate gland. That's the prostate gland. Another point to appreciate is that this one is a median umbilical ligament. So this median umbilical ligament connects the bladder to the umbilicus. And if you have a remnant of it, you'll have the various diverticulum. So bladder diverticulum, the various urethral anomalies, urethral fistulas will be coming from it if you have a remnant of it. So on this, you can be able to appreciate this is a trigon. You can be able to appreciate the trigon here. So this is the bladder trigon. It's triangular in shape, as you can see there, somewhat triangular. So at this point, it's a hemi-triangle because it's the base of that. You can see it there. Then this is a base, the superior aspect of the bladder there. On this structure, we need to appreciate these are seminal vesicles. Seminal vesicles, and then here, at this point, we can be able to see this is a vas deferens. So the urethra comes from the bladder. It will pass through the prostate. So you'll have a prostatic part. Before the prostate, you'll have a pre-prostatic part. And then you go to the membranous and then the penile urethra. For the other thing that you need to appreciate, you need to appreciate this. This is a rectum. So we can be able to appreciate this is a rectum. And then below it, this is an anal canal. That's the anal canal. And actually at this point, you can be able to appreciate even the distal aspect of the anal canal is actually being formed by the skin. So it has stratified squamous keratinized epithelium. And then you can appreciate this, the upper portion of the anal canal has the mucosa, which is as similar as the mucosa of the GIT, which is simple columnar epithelium. Maybe regards the blood supply of the rectum. Remember, the rectum is supplied by three arteries. We'll have a superior rectal artery, a mid rectal artery, and an inferior rectal artery. So the superior rectal artery comes directly from a branch of the inferior mesenteric artery. The middle rectal artery comes from a branch of the internal iliac, and then the inferior aspect, the inferior rectal artery, will come from internal pudendal, which is a branch of anterior deviation of the internal iliac artery. Another point for us to appreciate, we need to look at the various muscles that you can be able to see at this point. So we have this artery here. So the abdominal aorta divides at the level of L4. We will have the iliac artery. So this one is a common iliac artery. This is an external iliac artery. From the external iliac artery, we also have an internal iliac artery. So this one is an internal iliac artery. So if we reflect it, this is what we'll be able to see. At this point, we can be able to see this inferior vena cava, and the inferior vena cava is being formed at the level of L5 by the right and the left common iliac veins. So this is a common iliac vein. So the common iliac vein is formed by external iliac vein and internal iliac vein. So at this point, this is an internal iliac vein, external iliac vein, the common, and then here we have inferior vena cava. At this point, I would like us to appreciate some of the structures. So here we have a nerve. So this is the obturator nerve. the obturator nerve is here. So the obturator nerve, as it comes from its origin, goes and pierces the obturator membrane and then goes to the thigh. And then the other structure that we need to appreciate is this here. So this is a lumbosacral trunk. We have this muscle here. This is a psoas major. And then the other muscle that you can be able to appreciate on this surface is the iliacus muscle. Apart from that, maybe we need to talk about this muscle here, which is a tendinous in nature. So this muscle, which is tendinous in nature, is the psoas minor. So this psoas minor can easily be confused with a nerve, as you can see there. The other muscles that we need to appreciate, we have these are fibers of rectus abdominis, and then posteriorly you can try to find the fibers of pyramidalis, which might be absent in some specimens. Yes, so apart from that, another thing that we need to look at is that this is the anterior abdominal wall muscles. For the anterior abdominal wall muscles, you can appreciate we have this fascia here. So this is a rectus sheath that goes and forms, that covers the rectus abdominis and the pyramidalis muscle. And then you can be able to appreciate here, you have the external oblique muscle. So that's the anatomy of the pelvis. I'll see you in the next video. Thank you.